Welcome back to the PTCB Prep Guide. Today, we're diving into one of the most critical topics you'll face on the exam, respiratory drugs. These are the medications you'll see every single day for things like asthma and COPD, so knowing them is absolutely non-negotiable.
We're going to break all of this down into 3 simple tiers, which is going to make your studying way more efficient. We'll cover the generic names, the brand names, and exactly what each drug is for, so you can walk into that exam feeling totally prepared and confident. So here's our game plan. We'll start with the absolute must-knows in Tier 1. Then we'll build on that with important drugs in Tier 2, and we'll finish up with some good-to-knows in Tier 3, before a final recap to lock it all in. Okay, let's get into it.
All right, Tier 1. Think of these as your foundation. You are almost guaranteed to see these on the PTCB exam, so you really need to know them inside and out.
First up, the classic, albuterol. It's a SABA that's a short-acting beta agonist, and it works by quickly relaxing the muscles in your airways. This is what everyone calls a rescue inhaler. Next, we have ipratropium, an anticholinergic used for the daily maintenance of COPD. Then there's fluticasone, which is an ICS, or inhaled corticosteroid. This one's a controller medication that reduces inflammation over time. And a little tip, that "sone" ending often clues you in that it's a steroid. Finally, we have Symbicort, a super popular combo of an ICS and a LABA, a long-acting beta agonist that gives you both inflammation control and long-lasting airway opening.
Still in Tier 1, we've got Advair, another powerhouse ICS-LABA combination, just like Symbicort. Then there's tiotropium, brand name Spiriva. It's a LAMA, or long-acting anticholinergic, and it's a real cornerstone for daily COPD management. Now for something different, Montelukast, or Singulair. This one isn't an inhaler. It's an oral tablet that helps prevent asthma symptoms by blocking these inflammatory things called leukotrienes. And last but not least, prednisone. This also isn't an inhaler. It's a powerful oral steroid used to calm down a really severe asthma flare-up throughout the whole body.
Okay, this slide right here, this is absolutely crucial. You have to understand this difference. Rescue therapy, like albuterol, is for immediate relief, right during an attack. Maintenance therapy, like Advair, is something you take every single day to keep those attacks from even happening. Nailing this concept is critical for the exam and for real-world practice.
Now for Tier 2. These drugs build on that foundation we just laid. You will see these constantly in the pharmacy, and they are definitely fair game for the exam. Let's see how this builds on what we already know.
We're seeing some familiar classes here, which is perfect for reinforcing what we've learned. Mometasone and budesonide, 2 more inhaled corticosteroids for daily maintenance. Then we have salmeterol, a LABA, and here's where we see that pattern again. Notice that terol suffix on salmeterol. That's a fantastic clue that it's a beta agonist. Finally, there's lavalbuterol, another SABA that works just like albuterol for that fast rescue relief.
This next group focuses a bit more on allergies, which, often trigger respiratory issues. We've got cetirizine, you know it as Zyrtec, a classic oral antihistamine. For nasal allergies, there are 2 different approaches here. Azolastine, which is an antihistamine spray, and fluticasone as a nasal spray, brand name Flonase, which is a steroid spray. And then there's cromolyn, which is in its own unique class. It's a mast cell stabilizer. It basically stops inflammatory cells from releasing histamine in the first place.
Okay, on to our final tier. These are a little less common, but knowing them could be the difference maker on a tough exam question. This is where you can really show off your expertise.
Now, this tier introduces some pretty specialized medications. Omalizumab, or Xolair, is a type of biologic called a monoclonal antibody, and it's used for severe allergic asthma. Roflumilast is a PDE4 inhibitor, specifically for preventing COPD flare-ups. Theophylline is an older drug that you'll rarely see now because it requires a lot of careful monitoring, but it's still good to recognize the name. And zafirlukast is another leukotriene antagonist, just like Montelukast from Tier 1. And to finish up our list, we've got 2 common symptom relievers. Guaifenesin, which you definitely know as Mucinex. It's an expectorant that helps loosen up mucus. And then there's benzonatate, an antitussive that helps suppress a cough. And finally, we're circling back to reinforce 2 more key examples. Beclomethasone, another ICS, see that "sone" ending again, and formoterol, another LABA, hitting that terol suffix one last time. Whew! Okay, we've made it through all 25 drugs. Now, let's lock in those key concepts with a quick final review. This slide really brings it all home. Just remember, SABAs are your rescue inhalers. ICS/LABA combos are your daily controllers. Anticholinergics are essential for long-term COPD. Leukotriene antagonists are oral medications for prevention,
Antihistamines, like Zyrtec and Flonase, are for managing those pesky allergy symptoms. And systemic steroids, like prednisone, they're the heavy hitters you bring in for severe flare-ups.
So, one final check to really lock it in. Based on everything we just talked about, which drug on our list fits this description? Think about that critical difference between a daily controller and a powerful short-term treatment. Thanks so much for studying with us today. If you found this respiratory drug breakdown helpful, please make sure to subscribe to the channel, PTCB Prep Guide. We are all about simplifying PTCB prep using clear, tested strategies that are designed for maximum understanding and retention. Your likes and shares really help us grow and let us keep creating high-quality content for future pharmacy technicians just like you. And don't forget to explore the rest of our channel. We've got a huge library of videos covering everything you need to pass this not-so-easy exam. But with the right strategy, trust me, it's absolutely doable. Thanks for watching, and I'll see you in the next PTCB Prep Guide Explainer.